I hope you walk away feeling like this was valuable and certainly worth your time as you prepare for what could be to come. So allow me to introduce myself. I'm Lindsay Keisler, President and CEO of the Chamber of Catawba County. It is such an honoring and humbling privilege to serve you and work for business every day in this region. I want to say a special word of thanks to our partners that have assisted with the COVID-19 in Your Business webinar series for the last 21 months. Now, the Small Business Center at CVCC, the Small Business Technology and Development Center, as well as the Catawba County Economic Development Corporation. Thank you to our great partners who help us extend invitations to ensure that the business community, you all, have the information that you need in order to help continue to navigate through this global pandemic. So again, on behalf of your chamber, our board, and our leadership, I just want to say thank you, and thank you for partnering with us, and thank you for continuing to support your chamber and our efforts and being in it with you through this pandemic. So why are we here today? We hosted a webinar series a webinar episode back in September, and we had David Smith, who has been no stranger to this series, who came and talked about what were the mandates for the vaccine and testing mandates for employers of 100 employees or more that were coming down or that were announced. So now we have some more information, and my goodness, a lot has happened since early September. You may have seen the emergency temporary standard was adopted on November the 5th, and then lawsuits have occurred, as well as a stay has been placed on this order. David's going to go into all the timeline of events, so I won't belabor this, but a lot has happened. And so last Monday, we hosted North Carolina Labor Commissioner Josh Dobson in person here at the Chamber with a roundtable of business leaders from across our region. And after that, a very informative session, which I will touch on here shortly, we realized that business leaders are still in need of some further information on how this will potentially impact their business. What do they need to prepare in order for this, in the event that this order does stand and is not deemed unconstitutional. So as we do, we wanted to provide this information for you so that you can be prepared. You can feel like in the event that this does occur, that you will have a plan in place that will serve you and your employees well. Because this does have potential impacts, great impacts on your business. Now, a couple words from the commissioner. He stated, first of all, that North Carolina Department of Labor will not enforce this mandate while it's in the courts. And so that was great news for us to hear for businesses in North Carolina. He went on to express reasons why he opposed this mandate, which again was very encouraging to hear, but primarily the reasons were the potential impacts on your ability to attract and retain the talent that you need in one of the most difficult and challenging labor markets in history. So that again was very refreshing to hear a pro-business perspective from an elected office, one who manages our state OSHA plan. And North Carolina is one of 22 states with our own state plan. So I know David will get into that a little bit as well. So again, we hope you are able to take information away from this. If you do have a question that comes up during this session, please use the chat feature. So there's a chat feature. There's also a Q&A feature. You can put those questions in there, and Lori Alala, who is our vice chair of the Chamber Board, as well as the equity partner with Broom Associates, she is going to help co-facilitate that Q&A with me, with David, at the end of this session. So please, as we go along, feel free to put in your questions, but note that we will be answering those at the conclusion of his remarks. So without further ado, it is my honor and privilege to introduce Lori Alala, Equity Partner with Broom Associates, to introduce David Smith, our presenter today.
Thank you, Lindsay, and good morning, everyone. I am Lori Alala, partner at Broom Associates, a division of EbenConcepts, and I also have the privilege of serving on the board of directors for the Chamber of Catawba County. And on behalf of your chamber, we're pleased to be able to provide this presentation and legislative update on the vaccine mandate. We once again have the privilege of welcoming David Smith, Senior Vice President of EbenConcepts Company, one of the largest regional benefit consulting firms in the Southeast. And if you participated in past webinars, specifically the one in September, you may remember David, as he has provided a presentation on this topic at that time as well. David's background includes work in government with insurance carriers and over 20 years with employers and agents as compliance specialist and a consultant for large employer and self-funded group health plans. David has also served in leadership positions at local, state, and national levels with various professional organizations and speaks nationally, focusing on educating employers and agents, brokers, and consultants. David has also been recognized as one of our industry's top professionals. And David, we thank you for sharing your time and knowledge with us today. So I will turn it over to you and let you get started so that we can get right into the content of this webinar.
Thank you, Lori. Hope everybody is doing well, and hopefully you can see just the slide without any other stuff around it. It's always fun to try and move the slides over. So we'll get started, and thanks for the introduction. And again, I know the Chamber will provide a copy of the slides and a recording of this afterwards. I'll really mention that we're going to go over the OSHA Emergency Temporary Standard, really start with where things stand today, and then talk about the federal contractor mandate, as well as the CMS medical provider update. To re-emphasize what Lindsay and Lori have said, if you have a question, the very best way to get it to us is to click on that button at the bottom that says Q&A. And if you click on that, you'll get a little box that pops up that you can type your questions into. And then I know Lori's planning on delivering those to me as we go along, but I will typically be able to see them. And if there's something I can respond to immediately, I'll do that, just because otherwise I'll lose my train of thought. And so don't be afraid to ask questions. There are no stupid questions, because frankly, this is still a fascinating topic to kind of keep up with. Remember where we are today, really starting on September 9th, when President Biden announced that there were 4 requirements that he was going to have the agencies put into place to address the number of unvaccinated Americans. The first of those, which went into effect yesterday, was that all federal employees who work for executive branch agencies had to be vaccinated or face personnel action. And then the federal contractor mandate, so anybody who's a federal contractor or subcontractor, well, I'll take that back. Most employees working for federal contractors and subcontractors have to be vaccinated, as well as those who work in federal property or buildings. CMS has issued an order about healthcare facilities and related providers to require their employees to be vaccinated. And then finally, what we'll really start with is OSHA's issuance of an emergency temporary standard that is requiring employers with 100 or more employees to be vaccinated or tested. Remember, we're having this particular conversation because the last conversation we had was before the emergency temporary standard had been issued. It has now been issued. But before we go too far, I want to kind of mention a few things about where things stand. Now, week Friday, the Fifth Circuit Court of Appeals in New Orleans issued a permanent injunction against OSHA for enforcing the emergency temporary standard. This was kind of done concurrently with a number of other cases that have been filed to challenge the emergency temporary standard. And the federal court system has a process where if there are multiple cases on the same topic, they will assign all those cases to a single circuit court of appeals to be heard. That was done last Wednesday. And all of the cases, including the one from the Fifth Circuit that started this, were referred to the Sixth Circuit Court of Appeals, which is considered a relatively conservative Circuit Court of Appeals. The appointees are 11 of them were appointed by Republican presidents, 6 by Democratic presidents, and they're now looking at as a consolidated consideration of the bill of the pieces. At the meantime, last week, OSHA announced that they were pausing all implementation work pending the outcome of the cases. And so in the meantime, it's kind of where things stand right now is OSHA's doing nothing. Everything's kind of in the court process. But what we've said to people is now is probably the time to be prepared. It's not the time to actually do anything. But this idea of doing nothing until something has to be done may be a little foolhardy, because at the end of the day, our advice has been to prepare the vaccine testing policy, but only have to worry about it if it's issued by if it's okayed ultimately by the Supreme Court. And I would say anybody who is predicting what the Supreme Court will do is probably tossing a coin in the air. As you know, there are 9 members of the Supreme Court. Of those 9, 6 were appointed by Republican presidents, including 3 by President Trump. And at this stage of the game, we've seen a number of state and local mandates about vaccinations come across the Supreme Court's desk over the last 2 or 3 months. Every one of them have been ruled to be constitutional. And those have been ruled to be constitutional for a various number of reasons. The ETS, probably a wholly different consideration, but as I've predicted to a few people, I think that the ultimate judge impacting this decision will be the latest member appointed to the court, Amy Coney Barrett, who I think will be instrumental in deciding which way this particular case goes. That being said, let's say hypothetically the Supreme Court was to get this sometime next week, which seems incredibly unlikely, then they would have to make a pretty quick decision, which would make a decision ultimately mid-December at the earliest. I believe what this is going to effectively do is push everything back. As I mentioned, OSHA's doing nothing right now. And so if they had to start the engine back up, it's going to take them a while to get that going. And so, but they have indicated that they're prepared to implement as soon as possible once the Supreme Court has decided on this, and if they decide in favor of OSHA's ability to issue the emergency temporary standard. I mentioned that there are really 2 other pieces: the federal contractor subcontractor mandate, vaccine mandate, which we'll talk about more in a second, still is going forward. It's effective January 4th. And then the CMS mandate for covered medical facilities is also on track. There have been a couple cases challenging the CMS mandate for vaccination, but no court has kind of stopped that process. And so ultimately, and I'll talk more about that one in a second as well, but those have a couple different dates of requirement that are going to go into effect, and we'll talk in greater detail in a second. So on the OSHA side, I'm going to talk about the OSHA piece, not from the perspective of being pro or against. I'm just going to try and give you data about it so you're aware of what's in it. Really, there are 2 mandates within the emergency temporary standard. The first of those 2 mandates is that employees and quote unquote covered employees must be either fully vaccinated or tested weekly beginning January 4th of 2022. Again, I'm giving you the dates that are written. These are not necessarily the ultimate dates that these would go into effect. There are some restrictions about how the testing will be done. A COVID test cannot be both self-administered and self-read. And then employers are not required to pay for the costs associated with testing, which again, that whole piece there is a reflection of a handful of what I would call rather effective pieces of lobbying. Why is it January 4th and not December 4th that it went into effect? Part of the answer to that is because of the timing. The real answer to that question is because retailers nationally were lobbying the White House pretty aggressively to say, if you make us have vaccination mandates before the holidays, you're going to kill the economy on that front. And so they did step back from that. The other was that a lot of employers are concerned about the cost associated with testing. And so the administration, when they issued this rule, said that the cost of testing belongs to the employee, not to the employer. The second part of the mandate is that unvaccinated employees are supposed to start wearing a mask at work beginning December 5th. Again, this has been delayed pending the outcome of the review, but the mandate to wear a mask is when indoors or occupying a vehicle with another person for work, except for when in a closed room, limited time while eating or drinking, if they wear a respirator or mask, or the use of it is infeasible or creates a greater hazard. And so ultimately, that scope of that face covering piece is more immediate. Remember that they have said what a approved face covering is, which is that it covers the nose and the mouth, that it has 2 or more layers of breathable fabric, ear loops, last band behind the ear, fixed snugly over the nose, mouth, and chin. I've used that one for, giving friends a hard time over the last couple of weeks. And then it can't have any slits or exhalation valves. So ultimately, it's got to be a solid piece. So, rather specific requirements on that front. The mandate applies to employers with 100 or more employees as of November 5th. So if you have 100 employees right now, then the ETS will apply to you if it ever goes into effect. The 100 employees is based on the entire entity, not just one location. Commonly owned entities or control group entities could be included if they handle all of their safety within the one, for all of them under a common method or a common approach. Part-time, seasonal, and temporary employees are counted towards the 100-person threshold, and they are not fractions. So if you have 100 people on payroll as of November 5th or any time after that, then you are within the scope of this ETS. Independent contractors are not included in that 100-person threshold. And so keep in mind, when they look at this, they're saying, all right, well, as of November 5th, I had 95 employees. But then on the 10th of December, I went over 100. So at that point in time, the ETS applies to you. And then let's say you go from 105 back down to 95. That doesn't matter. Once you're over 100, you're over 100 for the duration of the emergency temporary standard, which runs out in May. We'll talk about that more in a second. There are certain employees who are not included in the vaccine or testing mandate. Those who do not report to a workplace where there are other individuals with whom they work or customers are not required to be vaccinated or tested. Those who work from home, those who work exclusively outdoors. So each of those has like its own branches of conversation. If somebody doesn't work in a workplace, but they come into the office every 2 weeks, then they have to be tested within 7 days or show proof of vaccination once they come to the office. And so if they come in weekly, they have to be tested and vaccinated weekly. If they come in less frequently than weekly, they have to be tested within 7 days of when they return to work. Working exclusively outdoors is one of those interesting questions. The guidance on that is kind of specific. And so if you'll give me 1 second, I'll read that particular question that's in there about the outdoor work. So let me just pull that up right fast so I can make sure I'm outdoor. So outdoor work is work that is then performed where they work outdoors all days. An employee who works indoors some days and outdoors other days would not be exempt from the vaccination or testing mandate. They must not routinely occupy vehicles with other employees as a part of work duties. So they don't ride together and with other employees in a company vehicle. That would not allow them to be excluded. And the employee works outdoors for the duration of every workday, except for the occasional indoor use of things like the bathroom, going inside to do something in the administrative office, but again, de minimis, or taking a break like a lunch break. So when they say it must occur outdoors, it doesn't include buildings under construction, etc. So, they're saying outdoors is an exception, but I think it's an exception and not really being very much of an exception. So, pardon me for coughing. I've been talking too much and my throat's starting to hurt, but it's not COVID, so I know that. Keep in mind that the emergency temporary standard does not apply to healthcare facilities. Those are covered by the CMS mandate. Employers are required to maintain a roster of employees' vaccination status and maintain that. So you've got to get the vaccination, proof of vaccination. There's a whole process of what do you do if they've lost their card, and a whole process about what to do if it's a fake card. But again, what they really are going to want is a copy of your card to prove that someone has been vaccinated in that situation, and then keep a record of that. And then if you have any employees who are hospitalized as a result of COVID-19 exposure at work, then you have 24 hours to notify OSHA about that. If you have an employee who passes away due to complications related to work, COVID-19, and that was due to work exposure, then you have 8 hours to report that to OSHA. That rule is a continuation of what's in place today. Employers are required to offer paid leave to obtain the vaccination and to recover from any side effects. So again, that paid leave is for obtaining the vaccination or to recover from side effects. Up to 4 hours has to be provided for the vaccination piece. And how the employer does the paid leave for people who are suffering from side effects could be anything like sick time, PTO, etc. Has been no extension of the tax credit aspect of this program. From a testing perspective, the testing requirement is that someone has to be tested at least every 7 days. It can be longer, it can be shorter, but it cannot be longer. And so it's that. The test has to be something that has been approved by the FDA for detecting a current infection with COVID-19, and it has to be therefore a viral test. And there's a handful of ways that that's done. It has to be administered in accordance with the instructions, and it cannot be self-administered and self-read. So an at-home test is fine, but the employee can't be the one that both collects it and reads it. They're going to have to do that either in front of an observer or in front of somebody designated by the employer. And so that could be hypothetically someone in a telemedicine setting, but again, self-administered, self-read tests are not permitted. Antibody tests, I get this question a lot, do not meet the definition for COVID-19 tests under the emergency temporary standard. So if someone's had it, we'll talk about that exception in a minute, then they've got a totally different thing. But somebody who says I have a heightened or an improved resistance to COVID, it doesn't get them around the fact that they still have to be submitted to a weekly test. Again, who pays for the test? Employees. Who pays for the time to get tested? It depends on whether or not the employer is directing the time and the place of testing if it's outside of work hours. So if you say you have to be at this place at 9 o'clock on Monday, then you have to pay them for the time of getting there, getting the test, and then going from there. So if you just say, I need a test result by Monday morning at 9 a.m., then that's a totally different deal. You're not directing the time and the place. So what do you do if an employee tests positive? Remember that you have to maintain a record of any positive tests or diagnoses, and then you have to require your employees to report it, and then remove them from the workplace. That piece is important because, again, the CDC guidelines. And then we'll talk about the return to work because something weird's in that. The top bullet point on this is important. If you have an employee who has had COVID in the last 90 days, they are not required to be tested for the 90-day period from the time that they last tested positive or received a COVID-19 diagnosis. So what that means is if they got a positive test result on September 1st, so October, November, December 1st, right? So that person would, it doesn't matter they had COVID in the last 90 days of right now, it's the last 90 days within the time that the vaccine or testing mandate goes into effect. And then once, so let's say you have someone who tests positive on February 2nd, then they would not have to be tested from February 2nd through May 2nd. Sorry, I have to do the calendar thing in my mind because my brain doesn't always work well. So I'm feeling like I'm either doing a good job or I'm boring y'all because I've gotten no questions that I've seen. So so here it's just the guidelines. These have not changed since July about, you know, when someone should be quarantined or in isolation. But ultimately, remember, someone has been in close contact and they're either vaccinated or have a positive diagnosis in the last 3 months and they have no symptoms. There's no requirement that they be out of work. They just need to wear a mask. If they've not been vaccinated, then they've got 10 days of isolation or 7 days if they get a negative test result. And then the difference between quarantine and isolation is there. Quarantine is you're staying away from, you know, everybody outside of home, but you could be around home. Isolation is where you are truly at home and no one else from home should be with you. So as Lindsay mentioned, 22 states, including North Carolina, basically have their own state-run OSHA program, which means that the state, and in this situation, Commissioner Dobson, as the head of the Department of Labor, has authority to implement and enforce OSHA guidelines within the state of North Carolina. Each state has some guidance or some variants they can make from federal OSHA guidelines. But in this situation, like nearly every OSHA mandate, the state has really 3 options. One of those is to adopt the ETS. So in this situation, the emergency temporary standard, they can just adopt it outright. They can adopt it with modifications. So they might tweak a little bit here and there, but there's a bottom line threshold of stuff that they have to do. Or they could choose to not adopt the emergency temporary standard, but they can't put in place a less restrictive requirement. So basically the question that's come up, and I'm sure that Commissioner Dobson addressed this, that if someone is actually, if a state decides to not force it or to not adopt it, what that really ultimately means is it's not that employers in that state get out of having to comply. It simply means that the responsibility for enforcing it will shift from the state back to OSHA. And so there's that. There's also been a number of states that have issued either mandates or prohibitions against vaccination mandates. And so you have employers who are kind of feeling torn between their state obligations and their federal obligations. But remember that under, you know, the federalism system, the federal rules will preempt any state rule. So the fact that Florida adopted a prohibition on vaccine mandates in the state of Florida doesn't mean that if ultimately this is passed by the Supreme Court, that Florida can prohibit it from being enforced. One of the things, and I'll mention this quickly, I've seen a couple of states that have a strong disposition against the emergency temporary standard are considering doing is adopting state law that would say if the employer is enforcing a vaccination mandate, that the employees who are under non-compete would be released from their non-compete obligations. Kind of a very interesting twist in this process to really kind of force the employer to choose between protecting employees and their relationship with their employees to their financial advantage versus being in confrontation with OSHA. So it's going to be very interesting what happens at the state level if this ultimately survives any kind of legal review. but I think we're really where we are in this. Keep in mind that everything in the emergency temporary standard is a minimum requirement. So an employer could hypothetically say, yes, we know we could give people a testing option, but we've decided to not do that. So you are going to have some employers who say, we're not going to do a testing piece. So there is some flexibility on that front as well. So remember, the penalties for non-compliance on this is really ultimately up to OSHA and the states that are enforcing it. And there are penalties that range from $13,000, $13,653 per violation, all the way up to $136,532 per violation. There is a provision within the Build Better Back Act that would increase the OSHA penalties, I believe, up to $700,000. But again, this is one of those deals where OSHA has fairly broad authority to decide if someone has violated the rule. And so how it happens from here is going to be interesting. But keep in mind, one of the ways that OSHA will ultimately decide to identify people is there will be situations where employees are the ones actually turning people in. And that's one of the things I want to make sure that people are aware of, some of the twists in this. One of those is that employers have to be able to provide some kind of basic reporting. If an employee walks into your office today and says, what's the number of vaccinated employees versus all employees right now? The employer, under the emergency temporary standard, has until the end of business tomorrow to tell that employee about that percentage. They're not required to say, these 8 people, specifically all have vaccinations and these 2 people don't. It's not the names, it's simply the percentage. But again, this feeds the idea that what they're doing is basically encouraging the employee to be in the whistleblower business of going to OSHA and saying, hey, my employer is not enforcing this at all. So then OSHA's got a for-cause reason to go look at them. The other thing that's weird in this, and this highlighted me this week, was that when someone does test positive, the ETS standard for someone returning to work is different than the CDC standard. And so what the ETS says is they can either receive a negative PCR test, they can follow the isolation standards, or they can obtain a return to work recommendation. And so that or is really strong and interesting, because being able to get a provider to say, yes, it's okay for that employer to come to work, even though they've not gotten a negative PCR test, is kind of a very interesting twist that we want to keep our eye on. So Deborah, looking at your question real quickly, because yes, I understand the temp work issue. The fact that those 100 employees work for you, even though they might be working at someone else's different site, would not get you out of the fact that you fall over 100. So you would be required, if the ETS is also put into place, would be required to do that. So some other questions that we've gotten, will employees be required to receive boosters under the rule? No. What if an employee quits rather than being vaccinated or tested? And I'd say it honestly depends. In most states, the answer to that question will be no, they are not entitled to unemployment. OSHA has said that they're going to do either random or pre-scheduled inspections based on objective and partial selection criteria, which I know all the ways that those words can be read. None of them make me feel good. Or unprogrammed inspections, which are really kind of we got word that you weren't doing this, and so we're going to show up and ask you some questions. The other really important thing to remember is that this emergency temporary standard, as it's currently drafted, ends on May 5th of 2022. So this is only a limited period of time. It's an emergency temporary standard. And so at this stage, it begins December 5th for the mask piece, January 4th for the vaccination piece, but then all of that will end for employers with 100 or more employees as of May 5th of 2022. So what should you do now? Ultimately, you should make sure you prepare a written vaccination and testing policy that would be effective January 4th, the mask mandate December 5th. And I say for whenever, if ever, just simply to have the paper done. And what I've got a lot of clients who said, hey, I just want to have this ready in case. I think that's a good idea, just to kind of go through it, see what it says, see what you could possibly do. You make some decision about testing rules, how you would handle discrimination accommodation requests. I'll talk about those more in a minute. But the EEOC has provided a model sample policy, which we can make available to people. And I've had a couple clients look at it, adopt it, implement it, which I think is a pretty good policy, and frankly gives you cover because EEOC actually gives it to you. So Matthew, I see your question about 100 employees in this state, but the larger corporation that has other employees in other states. The 100 employee count is for the number of employees who work for the company in the United States. So I'm going to take your question to the next level, which is we have 50 employees in the US, but we're a subsidiary of a Swiss company that has 1,500 employees in Switzerland. Are we required? No, because your United States employee count's 50. But to your specific question, you got 50 here and 150 in New York and 125 in California. You're over 100 in all 3 states. So you have to comply with this. So I'm going to move on from the emergency temporary standard to the federal contractor mandate. A lot of this stuff is similar stuff we previously talked about, just with some updates. So remember that this is for the duration of the contract. It really is related to contracts that went into effect in October. We'll talk about that in a second. There is not a weekly testing alternative standard for the federal contractor mandate. So this is a requirement that all the employees who are covered under this particular rule have to be vaccinated, but they do have to allow religious and disability related accommodations. And the work of the Safer Federal Workforce Task Force, I hate it when they use the same word twice in the name, came out and gave some examples of what a accommodation would look like for someone who was unvaccinated. They'd have to wear a mask at all times, except when they were eating and drinking. They had to maintain at least 6 feet from others at all times while in the office. They would have to work. You could allow them to work a modified shift. You could allow them to get periodic tests, which we're kind of generally recommending, given the opportunity to telework if that's possible, or if none of that works, to accept a reassignment away from the federal contract. But I think it's good insight into what might apply in other accommodation situations. Remember, the mandate applies to any new contract or similar instrument. So a new contract, an extension, a renewal, the exercise of an option on or after October 15th of 2021 for services, construction, leaseholds, contracts covered by the Service Contract Act, anybody who's doing concessions or work on federal property or lands related to services for employees, dependents of the general public. The exceptions are things like federal grants, contracts with a value of less than $250,000, contracts with tribes, and then manufacturing contracts under the Walsh-Healy Act. The consensus is that most supply contracts where, say, you're selling paper to a federal agency is not covered by this executive order. And then subcontractors are, and doesn't apply to subcontractors who are that solely for products. Other subcontractors who are working under a services agreement, a construction agreement, leasehold agreement, all of them have to have the vaccine or the vaccine mandate under the terms of this. This applies to covered employees who include employees who are working on a federal contract or in connection with that contract or working at a covered contractor workplace. This would also include people who are working indirectly on services related to the contract. So that might be people who are working on specific work such as human resources, billing, payroll, and legal review. So it is a broader than just the people who go and work at a site in Tennessee that's under the Department of Energy. It could also be the people who are doing payroll, billing, human resources for those people as well. The original vaccine mandate for the federal contractors was December 8th. That's now been extended to January 4th. As it relates to healthcare facilities, the Centers from CMS mandate, all the C's, all the abbreviations will kill you after a while in this business. So the mandate in this situation is that covered providers, and I'll give you that list in a second, and suppliers must have a mandatory vaccination policy. Again, no testing options allowed, but the employees can ask for a religious or medical accommodation. However, that has to be done by December 5th. So in the last couple of days, I've looked at and helped a few clients with medical, with particularly religious exemption requests. But ultimately, that piece is fairly straightforward, that if they don't request it by December 5th, then they're not entitled to it. The covered providers have to track and securely document the vaccination status of each of their staff members. This applies to not all medical providers, only to those who work for ambulatory surgical centers, hospices, psychiatric residential treatment facilities. It applies to programs of all-inclusive care for the elderly, including long-term care facilities, skilled nursing, nursing homes. Hospitals, in the broad sense of that, are covered by this. Home health agencies, outpatient rehab facilities, people who are doing outpatient physical therapy and speech language pathology services are required to be compliant. Community mental health centers, home infusion, rural health clinic, and then anyone doing end-stage renal disease facilities, such as anybody who's doing dialysis. All of them fall under this particular mandate. There are exceptions, which are physician offices not regulated by CMS, so you don't fall into one of those categories, and organ procurement organizations. Covered staff really means all staff, regardless of whether they're coming in contact with patients or doing other clinical work. And so it would include and apply to non-employees, such as students, trainees, volunteers, and anybody else who's providing care, treatment, or services for patients under a contract or other arrangement. So very, very broad application of this particular rule. The only exceptions to this in terms of who are part of covered staff is when you have someone who works completely remotely. So they're fully remote telework, they're doing payroll from home or whatever, and they don't come into contact with other staff members or patients in the scope of their work. So you have an employee who works from home 3 days, but they come into the hospital to work 2 days. This particular mandate would apply to that employee because they're coming to the hospital to work 2 days a week. There's been no exactly clear guidance as to what the penalties are, but we imagine it's going to be things like civil money penalties, denial of payment for new admissions for hospitals, or ultimately the termination of a Medicare and Medicaid service provider agreement. So fairly strong. What do you need to do now? And the answer to that question is get in place your vaccination policies. I would tell you that the COVID ones the ones done by OSHA may give you some guidance. Have in place your exemption forms, procedures to comply with any requests for accommodation. Train your managers, human resource staff about the requirements, including how to handle any religious or medical exemption requests that you may get. There's still the ongoing state versus federal piece. I believe that the feds believe strongly that because it's a CMS contract, that they can tell employers what to do regardless of what state law says. So that's going to be an interesting piece. Also remember that exemptions for religious or medical reasons have to be based on federal law. not on state law. So that will be interesting. Speaking of medical and religious objections, remember that medical exemptions have to be because of a sincerely held belief. I will say this, on the medical objection or the medical accommodation approach, I have generally taken the disposition that if a doctor is saying to you as an employer, this employee should not be vaccinated. And again, in this situation, I'm talking about it for all three pieces: the federal contractor, the CMS mandate, and the emergency temporary standard from OSHA. If you've got somebody who has a medical reason for not getting vaccinated, and you've got a doctor basically saying that they should not be vaccinated, then I would just default to an accommodation. The religious ones are really ultimately the stickiest ones ever. And Deborah, your question's a great one. There are forms, and again, Lori can send you a link to the folder where we keep some of that stuff. But ultimately, you're right. The obligation is on the employee to prove that it is a religious exemption. And so ultimately, remember that this is one of those deals where a religious accommodation is only to be filled when it's based on a sincerely held religious belief and not a personal choice. And I'm saying that at the same time, I'll talk about a couple of real world examples. Ultimately, you got to remember that this is religious beliefs, not personal beliefs. So I don't believe that I should have to be vaccinated. Okay, well, that's great, but that has nothing, you have no religious protection in that situation. You have to tie it back to some religious belief. And so that they don't like the vaccine. They've read some article that takes a particular political perspective on it, and that's how they feel about it. Great, but that's not a religious accommodation. And so it is ultimately the responsibility of the employee to prove it, and you have to engage in what's called the interactive process. You need to have a conversation with the employee. I will tell you, having facilitated a couple of those so far, with all respect to the people who have these religious beliefs, and I get it, and the people who don't want to have to be vaccinated, I would say that it's probably easier to put in place, to have the interactive process, have them make their case, because I'm not sure that it's ever going to be easy. And I'm going to share a real world example from yesterday. A client in Louisiana had an employee who sent in their religious accommodation request, and the request was accompanied by a letter from their parish priest. They're a Catholic church. And so the parish priest had a long form letter about why members of the Catholic Church should be exempt from this. At the very same time that I get it, I remembered reading and found pretty quickly a website on the Vatican website outlining why, under papal rules, that the vaccine, there is no religious reason to not take the vaccine under those who follow the Catholic faith. Now, as helping an employer, you could get into a conversation about this. And as I said to the HR manager of that particular place of business, we could write a letter back to the parish priest saying, Father, please explain to us how your letter reconciles with this letter or this doctrine from the Catholic Church. But we also realize that there's probably not a lot of that's going to come out of that process where there's going to be anybody who can make a decision. What I've said to people is then what you ought to do is put in place a reasonable standard for those people who have what you have, to the best of your knowledge, to believe valid religious exemptions. I will say this is one of those areas where I'm just not finding a lot of opportunity for conversation. And as another example, I had a client last week who got a letter from an employee who was requesting a religious accommodation and was outlining, why she believed that. And our response back to that employee was, okay, great. What aspect, what tenet of faith, what church do you go to, etc. And the employee's exact response was, it's illegal for you to ask me that question. Interestingly, it's not. And the reason it's not is because the employee has requested a religious accommodation. But was that conversation ever going to go somewhere where you could get something done? And in my opinion, the answer to that question, regrettably, is probably not. So what we have generally suggested is that they will need to be masked at all times, except when eating or drinking. Otherwise, they have to wear their mask all the time. If they don't wear their mask, then you can actually put them out, out of work without pay for not following the mask piece. Be tested regularly every week. And again, thinking about this from the provider perspective, as well as from the federal contractor and the ETS perspective. There is no religious reason to not be tested. There's no tenet of faith that is somehow violated by being subject to testing. We've also said that the person has to agree in writing that they will report anytime they've been exposed or have a positive test, and that it's their responsibility to maintain at least 6 feet of different distance from coworkers, customers, when they're, especially if they ever don't have a mask on. But even with the mask on, they should maintain a reasonable distance. The point is that you got to also have in place some reasonable alternative. I've had employees ask people for, I've had employees who said, well, I just want to work from home, and they're in a manufacturing job. And that's what my requested accommodation is. That's not a reasonable accommodation. And so remember, you're not required to do exactly what the employee asked. You have to find something that is a reasonable accommodation for you as well. And so you've got to find that middle ground. My advice is to document that conversation and your thought process. I think, Deborah, I answered your question. I'll mention one final thing. COVID, there was some guidance issued, I don't know, probably about a month ago about Cobra deadlines. Right now, basically, they've extended the deadline to pay Cobra premiums by an additional year. And so kicking somebody off because they did not pay their Cobra premiums gets a little stickier. But, we're continuing to kind of watch and see how that plays out. So I mentioned that we have a folder that's got some stuff in it, like a testing policy, a request for medical accommodation, the one from the EEOC for religious accommodations, and the employee tracking form. We're also working on a weekly testing tracking form. And then we've got a couple of vendors that we've talked to who would look at taking over the tracking and accommodation review request for clients. So we can share some of that information as well. So with that, I've done a lot of talking I think I've been talking for almost 50 minutes. So I will shut up and see if there are any other questions out there.
David, it's Lori. I just wanted to reiterate one thing. The Labor Commissioner, you had mentioned that he has the basically 3 options. One is to adopt the emergency temporary standard completely, adopt it with modifications, or not adopt it at all, which then would put our state in a position where the federal OSHA enforcement regulations would be put in place. I think he's in a precarious position, and I just wanted to restate that because I think people should realize it's not just as easy as him saying, okay, we're going to dig our heels in and not react to this. So that's one point I wanted to make. The other one is the Labor Commissioner, when we met with him, they don't have the staff to enforce this? I mean, I know there may be whistleblowers, and then at that point in time, they would have to react to that, but how will they have the staff to be able to actually address each one of those?
And I don't know the answer to that question. I know that that was one of the commissioner's first responses to this issue, was not having the staff to do the enforcement to the standard by which the OSHA is expecting it. And you're right. I think as a state, there's a good reason for us to have a state-run OSHA program rather than defaulting to the feds, because again, then we get enforcement that reflects what our state needs are. But ultimately, do I think that the feds try and creep over that line in some places? Yes, and I think it's one of those concerns about how it is implemented. And if I'm the commissioner, I'm very concerned about making sure that I'm preserving the right for North Carolinians to still enforce those workplace safety rules consistent with North Carolina standards, and not just a federal universal standard that may not necessarily reflect how we do business here in North Carolina.
Right. And I was very impressed with Josh Dobson, and he is very much a pro-business Department of Labor commissioner. So I was impressed with that. The other question is just a curiosity question, but if you've got the mask mandate that goes into effect December the 5th, and then January the 4th vaccine mandate, which he did make a comment about, it could be February the 4th because we're state regulated, and it could go a month later. So then you're in February, and this only goes through May 5th. So you're within 90 days. You know, as an employer, I'm going, okay, how, although I need to be concerned about this, 90 days is a very short time period.
It is. And I think ultimately, you know, you've seen a lot of, you know, I live with inside of Duke right here, and they've all had a, you know, they've had 95, 96% of their employees go and get vaccinated. And, you know, I think it's one of those realities where we're also, to Lindsay's earlier point, in this precipice between a low number of workers and the need for people to be there. And I see we've got a couple of the questions on here about what happens if they refuse testing or vaccination. I would tell you that under the rules that there is a requirement that if they're not going to submit themselves to testing, then that puts them at subject to disciplinary action on your part, up to and including termination, which again puts a lot of us in a very delicate place. You know, I talked to a good friend yesterday who's not been vaccinated, owns her own business, is not over 100, so probably not as big a deal. And I think people are making these decisions very much on their own basis. I think the hard part is if you don't take disciplinary action, let's say hypothetically that the emergency temporary standard goes into effect and you don't take disciplinary action, then you're subjecting yourselves to what are sizable penalties. And frankly, none of us like to write a check to the federal government for anything, but writing a $13,000 check or $138,000 check, neither one are attractive options for people. And so how do you find that middle ground between those two places?
Yeah.
So.
And so once this emergency temporary standard does go into effect, assuming it eventually does, then there was another question there about not being vaccinated. At that point in time, those folks would be let go. I mean, the disciplinary action would have to be enforced.
That's right.
Do you see this being pushed back so far that would be really even pushed back closer to the May 5th deadline and then become a moot point?
Well, based on a couple of things I read last week, there's some discussion, at least in the White House and in OSHA, that if it does get pushed back and the Supreme Court ultimately says that OSHA does have the authority to do this within the scope of the statutory provisions, and not many of you probably tried to kill yourselves by reading the emergency temporary standard, but if you did, of the roughly 100 pages, 80 of them are justifying why an emergency temporary standard should be implemented. And so they spent a lot of time trying to justify it. And in this situation, the thought is that if the Supreme Court came back and said that OSHA did have the ability to do that, that they might step back and then reissue it so that it would go into effect using that February 5th date as an example. And then the emergency temporary standard would be extended beyond May 5th. So they would take the one that's there today, repeal it, adopt a new one that matches it exactly, except for the date shift. And I think some of that's going to come out of what happens over the next couple of months. If we're honest, politically, in September, this seemed a lot more important than it did in November, because we've seen the infection rate, the rate of people passing away from COVID-related complications drop off pretty precipitously over the last couple of months. And so the need appears to have kind of gone a little bit away. But there's a little bit of that tick up. And frankly, we know with winter weather and people being sick in general, and then between holiday travel and everything else, those numbers going back up give them political wherewithal to do that. So I think that there's a whole bunch of things that could happen from there. See, Stephanie asked a question about employers being held liable for adverse reactions. It's interesting. I don't know that I've seen a lot of those cases on point. I think that if an employee gets vaccinated because of work, it's probably going to be covered under workers' comp as a work-related illness or injury. But I do think it's an area that there is some uncertainty about that. But so I would say that there's not an answer that they either are liable or not liable. In some states, it's been made fairly black and white that automatically, if someone from work gets COVID, that those are going to be considered work-related injuries and covered by workers' comp. But we're not all California, so.
No, well, I think we've covered all of the questions that were out there in the chat and the Q&A. So seeing no others, and I know it's right at 10 o'clock, David, I want to thank you, and I'll just turn it back over to Lindsay to close us out.
Thank you, Lori. And I would like to echo your thanks to David as well. David, thank you for always being willing to come and provide an update to the businesses in our region. I want to thank Broom Associates as well, Lori, and your leadership as our vice chair, but also being just a great partner of business with your firm. So thank you again to the Catawba County Economic Development Corporation, the Small Business Center at CVCC, and the Small Business and Technology Development Center for helping us promote the COVID-19 in Your Business webinar series. As was previously stated, we will send a recording of this webinar as well as the slides that accompany it. I know that there were several of you that have called in. You probably weren't seeing the slides, so you will receive those in your inbox, especially to all of those that registered for this webinar.
Lindsay,
yes,
I can also provide those additional resources that David mentioned in the presentation. So just let me know, and I'll get those out to the appropriate people.
Excellent. And again, all of you that are on here, we thank you for your attendance, and just be on the lookout in your inbox for a follow-up to this session sometime later today. So again, with that being said, we stand adjourned.
Thank you. Happy Thanksgiving.
Happy Thanksgiving, everyone.